I'm Ian Banks, and I'm an accident and emergency doctor in Northern Ireland. And the reason why we're here today is to actually think about this phenomenon, and it is a phenomenon, about the walk-in centres. The walk-in centres were a government invention, if you like, and they were to address the immediacy and the efficiency of healthcare in such a way that people felt they had the power themselves. They enabled these patients themselves to be able to get the right advice at the right time in a way that they could actually use. I'm probably biased as a doctor. I really like these walk-in centres. I like the freedom it gives, and I like the way it enables patients to take more control over their own destiny when it comes to health. But not all doctors think the same way. A lot of doctors have got serious and genuine concerns over the quality of care, for instance, the continuity of care especially. In other words, do they know when their patients are actually being treated by other doctors or other nurses? So here I am in Liverpool, at one of the busiest walk-in centres in the whole country, and I'm going to get under the skin of this walk-in centre to find out how it really works. Hey Joe, Ian Banks.
Hi.
Joe, it is crazy out there.
Typical day.
They're hanging off the ceiling. Can't be a typical day.
Always.
This is the way it always goes.
Always, every day.
Good grief. Right.
Come on through, it's a little bit quieter.
Lovely, lovely. You're obviously used to pressure anyway with the number of people out there.
Here, yeah, because we're probably one of the busiest walk-in centres in the country.
Really?
Mm-hmm. I'm the nurse manager at the centre.
Right.
Well, I'm covering the shop floor today, so we'll see anything that walks through the door. Patients come in, are triaged by the triage nurse and then taken into a consultation room.
I notice you've got GPs around the area here. How do you get on with them? Is it an easy relationship?
Yeah, we do have quite a good relationship with the GPs, and if we do need a patient seen by their own GP, the majority will take the same day referral.
And which brings me to another point actually, and that is about quality of care and the cost of this quality care. Now, money's tight at the moment. Do you think this is the best way of spending the NHS resources?
Personally, yes. I mean, you've only got to look at the waiting room, see how busy it is. People come here, they're seen, they're treated and discharged.
My GP, you've got to make an appointment. They say, ring up on the day and they'll give you one. But when you do ring up, they don't. They say, we haven't got one until next week. Also, I can come in here when you need to and you can get seen to.
Well, the thing I do like about the walking centre, it's nurse-led based, and the ladies and the nurses, they're a lot more approachable. That's what I do like about it. I find them they're good listeners, and they explain everything to you, and they just reassure you.
Do you really think we need walk-in centres?
You should ask the patients that. All 250 of them that come through the door. We're open from 7 o'clock in the morning until 10 o'clock at night, so they don't have to make an appointment. They can fit their day in around coming to visit us.
But what are the challenges about working at a walk-in centre?
About never knowing what's going to come through the door, how many patients are going to come in. When staff go off sick, you're trying to fit all those patients into the limited number of nurses then.
Staff, patients, all agree on the basic issues which surround the walk-in centre. So let's talk to Lee Montgomery from Clinical Solutions, a software company. Let's see how they address these issues.
Over a number of years now, we've been working closely with the user community to develop something which is more sophisticated and which meets the needs of face-to-face consultation and assessment. They've got to be seen as offering a cost-effective service and also meeting the service demands put upon them by the patients or the users.
The principal features of our walk-in centre product are first and foremost the triage capability at reception, at the nurse consultation and with the clinician. That enables the walk-in centre to treat the most appropriate patients. Secondly, through our face-to-face scripts and through using one single solution to run the whole walk-in centre, then there's no duplication of information within the organisation, and there's a creation of a single electronic record for that patient and any future encounters that they may have with that walk-in centre.
The algorithms themselves have been written by clinicians. They understand what clinicians' needs are and what patient needs are. This functionality is important because it actually promotes better performance from the users of the system, whereby more patients then can be seen. The actual algorithms underpin the skills of the nurses.
So what is this computer software?
This is the old CAS, now Clinical Solutions software. Input patients' details and data, and it is accessible then to all the walk-in centres. So wherever the patient attends, we can then see what's happened to them in the other walk-in centres. This walk-in centre has expert nurses from expert backgrounds. We have a good computer system that is accessible to all 4 walk-in centres.
It's not a difficult system to use. It's built on familiar technology. Anybody that's used Microsoft Windows or Office will see very similar functionality within the application. So hopefully that will impact on training, making training time less.
A more efficient service, lower cost of the service, should make staff and patients even happier. But does it work in practice? Does the software increase or decrease the amount of paperwork that you have to do?
Definitely decreases it.
We
We do send out letters to GPs and health visitors after a consultation if the patient's happy with that. But if for some reason the system goes down, everybody's up in arms.
Is that right?
You forget what it was like to do paper notes.
Starting to get the pens out.
What's a pen?
We're very fortunate at the moment. We've actually just changed over to this new clinical solution system, which has only been in our actual walk-in centre now for the last month, and it's improved our working practice greatly, I'd say, because prior to that we were sort of very heavily reliant on sort of paper-held records. So a lot of times, records were getting mislaid, and also problems with things like legibility and sort of, having difficulty sometimes reading records. So it's made a big difference, from that point of view. We are using it, and I find that with this electronic health record, we are actually finding it more sort of accessible. It's more easy to use. It's sort of quicker. It's convenient, and particularly for things like assessments for children, and particularly things like wounds or sort of burns, we can now use the body chart, which allow us to actually document very accurately the size and sort of areas affected.
Our clinical content has been used by the world's largest healthcare call centres for many years, with over 16 million calls going through those services. And on that basis, from a clinical risk perspective, our products have been proven.
The system provides an automated audit trail which dates, times and names any activity done by the user. This is obviously essential for clinical governance issues and service improvement, and obviously any manager or individual nurse can look back at any of the audit trails and see exactly what's happened with a patient regarding outcomes, activity and so on. The future in healthcare provision is through information systems and information technology. It's got to be, we can deliver more functionality to people's fingertips, limiting the amount of resource needed to take up that healthcare activity.
I think it's going smoothly, and I think most of my colleagues now actually recognise and see the sort of improvements it's made with the sort of the working practice as well. So I think it's made a big difference.
Clinical Solutions, bringing decisions to life.